Look, we made it through number 4. Congratulations.
Yes, we are here. Um, so we spent today talking about step number 4, and you'll see, what are all the words in the title. So supporting resilience and healthy behaviors and community engagement. But really, I think I hope one of the things that you will take away from today's session is that as infodemic managers, we need to think of new ways of what we perhaps understand as a community. We need to think also of new additional ways of how we engage, what are forms of engagement that we can choose, and also how we build resilience, what that means to us, resilience to the infodemic. And these could be also things like what Mina was mentioning this last presentation, which is actually being fluent in the way that the online conversations actually form, and what are the tactics of for example, disinformation or misinformation campaigns online, so that one then more deeply understands that this is not only about content production and amplification through partners, but that there's other ways, through other networks, through other partners, through other communities, where potentially we can engage, especially in the digital space, in a way. Engagement in physical communities is a lot more mature in public health than the engagement online. And I hope that today's discussions give you a bit of a food for thought of both are important. So this is not the question of online or offline ecosystems. It's actually online or offline spaces. It's actually a question of how we as infodemic managers, how we can support health authorities to effectively engage, because in the end, every person is part of different communities, and these communities intersect in this one person, whether they're physical or digital. So before we go into the usual takeaways, this is one very important slide that Liz and I want to share with you, which is really to appreciate the continuum of community engagement and the forms that it can take. Liz, do you want to walk us through it?
Sure. So this is, I think, a really helpful illustration of how what we want to get away is from this idea of tokenism, or this idea that we just should tell communities things that they should be doing and expect that will magically change people's behaviors or build trust. What we really need to do is to increase our level of community involvement, and we do that by moving towards the right-hand side of this diagram. So we go from outreach, which might be a little bit of community involvement. Communication really is one way. It goes to the community. You're providing the community with information, but you're not getting a whole lot back. In a consult is you might have more community involvement. You might be getting most information goes to the community, but then it comes back that they might be seeking answers to questions they have. And then you might be getting a bit of feedback. And then you're getting closer to, I think, more meaningful involvement through involve and collaborate, which is better and deeper community involvement, where you're kind of working towards this participatory and bi-directional flow of information, that you are involving more stakeholders in that conversation, and that you're forming partnerships ultimately at all levels with different parts of the health system and the process by which you're offering health services to them. And at some point, the dream is something that's shared leadership, but at the end of the day, when it comes to health system strengthening, it's not likely that you're going to have every community or neighborhood group give you advice on when the next immunization campaign is, or what should be the latest social measures around the latest health topic that people are worried about. But it is really important to at least try to get towards collaboration. How do we better listen and understand and lean in, and to really get a perspective from the community level about what is it that they need, what questions they have, and how might we better address them, and how might we tailor our services in ways that are respectful and appropriate to those communities. It's not just communication. And I really want to emphasize this. It can be very, very tempting to think that if we just communicate our way out of this, that's how we build trust. If you think about Richard Cordero's presentation where he talks about crisis and emergency risk communication, there's a very thoughtful definition for distrust. Distrust comes from the idea that promises have been broken and values have been violated. And sometimes if you communicate and you actually don't do the things that you promised that you're going to do, you really are you're breaking promises, and you're not fulfilling promises that have been made or commitments that have been made. And that is an easy way to lose trust from the community. And so we need to be building that trust. And that means, walking the talk. And so when we make promises, we keep them, and that we really listen, and that communities can see how their feedback and their input is actually shaping how health services are being delivered in more thoughtful and productive ways. This is really, really important. I'll give you an example. Early on in the vaccination rollout in the United States, there was a lot of questions, a lot of concerns about the vaccines, and particularly in minority communities, communities that have been disproportionately affected by COVID-19, who had very low trust in the health system to begin with. And there were a lot of efforts early on to get as many vaccines as possible, as quickly as possible, to as many communities as possible. And what ended up happening is that they would set up these mass vaccination sites run by people wearing military uniforms. Now, if you're living in a community where you don't necessarily associate people wearing military uniforms as trusted messengers or people that are worthy of trust, then that can have the opposite effect, is that through this engagement with communities, you're actively harming people's trust in the system and making it harder for people to get vaccinated. And so that's an example of how you can actually make the infodemic worse by having approaches that might come off as tone deaf, or not really understanding what are community questions and concerns, and how might we offer services and engage with them in ways that are respectful and really understand the needs of those communities. One size does not fit all for any type of RCCE activity, and one size does not fit all for any kind of infodemic management intervention. Every community is different. Every community has different needs, and you really need to lean in to listen, understand, and then tailor your approaches for every community. And so hopefully we really want to urge you to get to the right-hand side of this diagram as much as possible, because a community that really feels involved in that decision-making process is more likely to own health promotion activities, and that will promote shared accountability to meet health coverage targets. That's really critical.
And maybe just to add here, this is Liz was very eloquently explained this, but when we keep repeating that infodemic management and the infodemic manager connect between the different functions of the response, so community RCC and different health programming, etc. This is why this is needed, because it is not only about communication, it is actually about action. And if we are not making sure that the response activities and the health authorities' actions are not in line with the what is being discussed and what is being exchanged with community, then you literally we are setting ourselves up for failure. So you as an infodemic manager, think about how you integrate and how you also explain these and push for not excuse me, not breaking promises and not violating values of the communities that you are engaging with. So this is really, really important. So yeah, what are the key takeaways then? Liz and I summarized some for you because as you noticed, we felt that for the live lectures today, it was really important to have you speak with and think through the examples of how people are in their own jobs and in their own organizations approaching forms of community engagement. And so we now summarized a little bit of these takeaways of the framing or of the context of community engagement. So we really one key takeaway for you is that building resilience from infodemic management perspective, it means not only improving the health system's ability to address information voids and questions and concerns, but it's also about helping individuals and communities navigate the infodemic successfully. So you're building resilience within the health system and public health practice. And on the other hand, you're also very thoughtfully through interventions and through different activities, engagement can also be an intervention, building that self-efficacy. Infodemic management encourages individual behavior change, and it supports more fully informed communities to ultimately improve population health. So your activities complement, support, and make RCC better. So what you watch out to do is to basically add to what is already there and collaborate. So one example of this is that infodemic insights that you can produce can strengthen RCC activities, and RCC activities can then also be leveraged to also address infodemic related challenges. So this partnership is really important. Of course, you know, if you remember this continuum of community engagement that Liz talked about, the more you come to the right-hand side, so the deeper the engagement with the community is, that also allows for more robust and insights that are also grounded in the lived experience of the community. And this is especially true for vulnerable populations where typical social listening tools will miss them. And if and when the vulnerable populations are a priority for you to understand and to deliver infodemic insights for, you need to really be paying attention to that. Now, of course, another thing which I kind of touched upon earlier, individuals all have multiple identities and they belong to multiple communities. So you can't just target one community and walk away or be satisfied. Actually, you really need to choose a community of focus when developing infodemic interventions. And like Liz explained, every community is different. You will actually have different approaches and different way of doing things with each. But you do need to be strategic and thoughtful in how you engage and who you engage. Liz, how about second slide?
So here's the thing. You already heard from a variety of different perspectives today. And so what you really should remember is that where the health system meets individuals, such as that healthcare provider-patient interaction, are also places where you can build an infodemic management intervention. So it's not just community-based interventions. Think about health system side interventions as well. We should be equipping all health professionals everywhere to be able to address the infodemic at the individual level, within the health system, and when they work with patients. It's really, really important. And it's also important that you should encourage those feedback loops with different communities into the health system and incorporate them into insights that also include data sources that are internal to the health system. So that's not just having people submit feedback through community listening session notes or through looking at social media monitoring to understand how people are talking about a particular health issue, but also can incorporate internal data sources. So for example, at CDC, we have CDC Info, which is a huge hotline where anybody around the world can call and they will get expert advice from somebody on any potential health topic you could possibly have. But that can be a really helpful unit of analysis to understand, well, what are the questions that people are asking this week? What are they worried about? And how do we make sure that we have better answers and we have better information and better guidance to address those questions? And so combining those types of insights, internal and external, can give you a better sense of the infodemic and what you might be able to do to sharpen those RCC interventions that are being used. Also, nothing for us without us. This is actually, I think, a line from a presentation that came from a WHO colleague earlier on, recognizing that if you're designing for communities and you're intervening for communities, you have to do it with the communities that you are trying to support. Talking at communities is not sufficient. And then it's really important to also think about information equity, where communities are not getting credible or current health information, particularly if they're a vulnerable population who might have less access to the health system, less access to social services, or are less socially connected to other networks. We need to be very careful about making assumptions about what's going on in those communities, what their questions are, what the infodemic looks like, how it's affecting them. And so learning more and understanding more and addressing those information gaps is really, really critical. And I think Sarah has did a great job explaining different ways of going about that. So these are some of the things that we hope that you take away from today across all of the speakers that we heard.
Yeah, and maybe just to add here, Liz, when we're thinking about health professionals, it's actually quite a broad concept depending on where you are. Absolutely, you do need to work with healthcare providers, but health professionals, for example, can be pharmacists, they can be social workers. There's
Community health
even
workers.
yes, community health workers, librarians, really like wherever people are interfacing with the health system, that may be useful for you to consider intervening and strengthening the resources, giving resources and supporting the people that are working with the communities or with individuals as well. So we prepared a summary of key resources and guidance. There's several guidances on risk communication, community engagement that would be of interest to you here. There's also an open virtual course on RCC for COVID-19. And then Liz found some or listed quite a lot of really good resources, the tools section. Do you want to summarize them?
Yeah, so a Compass for SBC, there's a ton of content from USAID funded projects around the world that have been doing a lot of social behavior change communication and community engagement work around COVID. So there's a huge repository there. There's this really nice digital community engagement toolkit that we found, as well as a community health assessment toolkit. And the community health assessment toolkit was actually meant for hospital and health systems. So thinking about community engagement as a hospital can be very different than thinking about community engagement as a community-based organization, for example. And then we have a page that actually talks about ways health departments can increase COVID-19 vaccinations. And the reason why that's included here is because there's a lot of thoughtful ways of engagement on that, of like where people live, work, pray, play, study, and gather that might be potentially helpful for thinking creative out of the box approaches for where you might meet people and where you might promote health messages or leverage interventions. And so we have a series of sample metrics and measures. These are just some of them. Again, it will depend quite heavily based on the intervention and the community and the way you're interacting with them. A lot of the indicators that are out there are not fantastic and they need to be improved upon. But just to say that there's a lot of different ways of measuring the beast, as it were, in terms of how is an infodemic affecting a community, and if you try interventions, if you engage with that community, how might you see if there's been an improvement on a particular metric or measure here. And some of these get at things like individual level of cognitive resilience against misinformation or concerns or false claims. Others here get at kind of like the ability of healthcare providers to adequately answer questions and concerns that patients have. You can also look at like a number of health claims that are flagged on social media platforms by users. So are users actively flagging misleading content? And if they're doing that, that's a good sign that they're able to successfully and effectively identify when there's something that it looks really dodgy and being able to report that. So these are just some of the ways that you might be able to measure different aspects of this.
So what do infodemic managers need to know? This is a little bit of repeat, but really do consider how to involve communities more holistically in data collection and use, and also in intervention development and implementation and evaluation. Really, RCC interventions are vital to managing local infodemics, but other tools such as policies and health system engagement are also important to consider in your work. Infodemic managers should make community engagement part of the regular activities. So hearing directly from individuals and communities about their questions and concerns can inform your work. This is a big part of your ability to generate better insights based on social listening. So where possible, co-develop guidance with the communities you're targeting. You saw some examples of that today. And develop stronger partnerships with non-traditionally involved communities, such as employers and unions and faith-based community at large, arts and culture, hospitality, tourism, transport, universities, entertainment industry, etc. What about managers of infodemic managers, Liz?
So they can really help bridge that gap between where the data might be collected and where those insights are generated, and how those nodes work with RCC colleagues in activities. So connecting those dots is going to be really, really helpful. Prioritize for infodemic managers which communities should be focused on for social listening, especially if there are specific communities where they're looking for higher uptake of certain health behaviors and that might be lagging, for example. And so how might you double down on those communities to really understand what's happening, and address their needs to increase, whether it's vaccine uptake or encouraging social mitigation measures, whatever it might be. And then actively solicit community feedback and then advocate for stronger community engagement activities that inform all of those processes. So don't just stop with doing an informational meeting. There are other more innovative ways of engaging with communities that are outside of the box. And encouraging creativity in that can certainly help reach more communities that might have been harder to reach through more traditional types of engagement. And then trying to promote the idea that all guides should be co-developed with communities. Again, this whole idea that human-centered design and co-development with communities and leaning in to get community feedback. This might feel really strange and alien for some health systems, and for others it might be much more natural. But just to say that if this is an area of growth, definitely try to build this into the culture of how a health system does business. That's how they can help. What I would like to say is that many countries, particularly low income, middle income countries, are far better at this than high income countries, because part of your day job, whether you are running a local health facility in a rural setting, is actively doing community engagement. And that's the thing that I think everybody should be building into their day job, no matter where they are. And I think that's both true for infodemic managers and managers of infodemic managers. Do not get stuck behind a desk looking out the data all day long. Like you need to interact with community members, understand and listen, and walk the talk.
Yeah, and yesterday I actually gave a talk and then had a conversation with a university in southern Brazil that is actually changing all of their curricula for all of their health sciences programs for all profiles of health professionals, to include community engagement into the basic training, both of the undergraduates and the graduates. And they're also very much making community engagement as part of the training. I actually think that this type of approach needs to also be included in now I forgot the term, but the postgraduate education, so on the work on the job education, because really every public health professional needs to have this skill set, and ideally would actively use it, but that also means that the public health practice and the health system internalize this value, or the appreciation for how to engage with communities and how to do it in a respectful and and a positive way. So just a thought, really community engagement is really the business of all of us. And this is where infodemic managers, also with the mindset of human-centeredness, we can really help explain this to colleagues and to introduce this into our work. Liz, would you perhaps discuss the considerations? Excuse me.
If you're on a bicycle, if you're the one guy or one lady doing infodemic management, you want to coordinate as much as possible with RCCE colleagues, which is true for everybody, but even more so because those RCCE colleagues might not be sitting next to you or in the same office or in the same unit. So reach out to them. Consider doing some basic user testing to figure out how to improve existing channels for communication, such as the Ministry of Health website or whatever the website is where information about COVID is made available to the public. Focus on small doable actions, small doable improvements. You might not be able to reinvent the world, but there are small things you can do in your lane that will address the infodemic in small, thoughtful ways. If you are driving in a sturdy 4x4, you want to advocate for stronger data collection and indicators and RCCE activities that might be helpful for creating infodemic insights and strengthening that data sharing approach. Consider developing specific net metrics on individual community or health program resilience to the infodemic, and we gave some of those indicators earlier. Optimize processes for turning up up-to-date insights and guidance for RCC to better meet the changing epidemiological picture. What I mean by that is you don't want to be offering insights on a monthly basis. That's probably too slow for what our RCCE colleagues need. So figure out what is a better way to optimize that loop. So you're giving them what they need, actionable information as quickly as possible. And then again, co-develop your guidance with communities where possible and seek out innovative new partnerships. And then if you're in the luxury vehicle and you have a huge team that can do this work, you want to develop tailored insights and products for different communities, collect additional data to address information voids about specifically vulnerable communities that you're focused on, support implementation science and evaluation. Again, measure what's working and what's not working, and then tell the rest of us so we can not repeat the same mistakes and that we can leverage the interventions that are promising. And then send feedback from stakeholders on insight usefulness of infodemic reports and interventions for specific communities. So really, we want to make sure that the products and the insights you're creating are actually useful to those who are working in RCCE. So ask them for their feedback. Is this format working? Are there other insights? Are there questions that we're not able to answer? Is there a better way for us to provide this intel to you that will make your life easier? That's really what you want to be all about when it comes to this.
Great, thank you, Liz. We are 1 minute over, but I want to just point out one slide about the assignment, the video to the Minister of Health before everyone goes off and also has a good rest of the week and the weekend. Let me just share the screen. I dropped this slide also earlier in the Wisdom groups, and I just wanted to explain. So all of your work for the pitch is based on that the fact that you did build a team both with each other and with the collaborators in Wisdom, that through the different exercises that you've done, all of the reviews, you've understood the current situation in the country. You have by now also identified some gaps or have an ideas about opportunities on how to strengthen infodemic management, where the pain points are in the country. And you have some thoughts related to what you would want to pitch to the Minister of Health for advice, because the ministry has asked you for advice on how to move forward. So how do you make an effective 5-minute simple talk for the minister? And the minister is very busy, so he will only listen to you if you make it simple and punchy. So state what the problem is, present the data and evidence why this is a problem or what potential solutions may be, then propose the solution, maybe even show an example, and then make the ask. So what are you asking the minister? What is the action? What are you asking the minister to do, to decide, to confirm? And this is it. So this is an effective way of speaking with a policymaker that's very busy, that is seeking from you guidance and recommendations so that they can make a quick, informed decision. Liz, do you have anything else to add?
Yeah, you have to boil down a lot into only a few slides for 5 minutes. This is really hard, but it's also a really useful skill to have, because this is really how real life works. And so if you have any questions, you know how to reach us, and you know how to reach your coaches, but this is what you need to boil it down to. You don't have to have these titles on your slides or in your presentation, but these are the pieces that should be in there. It can be, you guys can do it whatever you want, as long as it's videoed. So all of the instructions on how to submit is in that deck that's been dropped into everybody's chat. So let us know if you have any other questions beyond that. And with that, we have our exit Slido poll open. Please let us know what worked, what didn't work today, how we can do better. We really appreciate your feedback. We ask you this every time, but it helps us make sure that we improve every time to make a better session to plan for you next time around. For submitting the video, let us know if you have any questions on that. Otherwise, we hope you have a great rest of your day and have a great weekend. A lot of you will be working very busily on your pitches. Look out for feedback from us on some of your group assignments very shortly as well. Thanks again, everybody. Have a great day, and we'll talk to you soon. We'll see you very soon.
Thank you, everyone.
Bye-bye.